Hi, Courtney here, and I'm here today to talk to you a little bit about medical yoga therapy or working as a yoga teacher or yoga therapist in the medical world, how I did it, and what that looked like, because I get this question a lot. How do you work in the medical world as a yoga therapist? And I would say, first of all, I'm sorry, my dog, I don't know what's up with him today. He's acting crazy. First of all, I would say you got to figure out your why. You don't want to just work in yoga in the medical world just because you feel like it is a more prestigious field to work in. You really need to want to work with yoga in the medical world because it is often a humbling experience and it is often not as exciting as people think it is. You really have to get your ego out of the way. The people that want to work with you, that not necessarily want to, but will be in your presence, may or may not want to be there. They may be there because their doctor has told them to be there. And that can be a completely different kind of ball game than work going into a class where people actually want to be there. So you need to know your why. Let's say that you want to work in yoga for heart health because you had family members who had heart conditions, or you yourself have a heart condition and you want to help people in cardiac care. Or you want to work with people who have cancer because you know someone that you love that had cancer and you want to help other people have an easier time with that. So get down to your why. And then the second thing I would tell you to do is to learn. You've got to learn. As a yoga teacher, I've been teaching. I'm in my 19th year of teaching. I've been practicing since I was a kid, and I'm 48, so a long time. I've been practicing consistently for 30 years, but I practiced even before that, but not consistently. So I've been learning most of my life, and I will read things. I go to classes, I go to trainings. I've gone to multiple trainings to try to learn as much as I can. And I will say all the trainings I have had have helped me in some way with what I do now, or I should say all the trainings I've had that have been outside the general population yoga world. A vinyasa yoga training would not help me with what I have do now, but a training of yoga for 12-step recovery was very helpful for what I do now because it talks a lot about the connection of the mind and the body. Learn, read, train. You just have to keep getting training. That's something you have to do. But a lot of people are credential, they keep trying to get more credentials, but they're not actually doing the work. And one of the things you have to do is just to get out there and do the work. You just need to be one step ahead of the person in front of you to help them. You don't have to be an expert necessarily, but if you're working with people who have cancer or who have heart disease, obviously you need to know enough to be responsible to be working with them. So the next thing I would say is, as people have come to me over the years as a yoga teacher, yoga therapist was not a word when I started teaching yoga. That was not a thing. People didn't talk about it. You never heard about it. Yoga therapy has only become very popular in the past 5 to 10 years, I would say. And even though it's pretty well known now, you never discussed it before. I just started taking private clients, and they might have cancer or had cancer, or they might have congestive heart failure or COPD. And I learned a lot by asking questions. What are your limitations? What can you do? What do you need? As the doctor told you, you can't do anything. Are you released? And by working with people, I would find out a lot about what was going on and how to modify the practice to help them. If someone comes to me, let's say they have a rare condition, I'm going to look it up and read all about it and what the treatment is before I dare get to working with them. I'm not going to work with them until I understand if there's anything or any limitations that I need to have or modifications. Oftentimes, if it's a physical problem, I will look up the physical therapy for that or the therapy protocol for that, and I will see what they do, and then I can usually translate that in my head to what would be appropriate in the yoga world for what they need. So study, study, study. Again, you don't have to be an expert, but you do need to try to find out everything you can every time a yoga client comes to you with a need. Then you want to just start teaching classes in that area. So you can learn a lot by just teaching beginner and chair classes. That's where you're probably going to find the people who are going to come that have some kind of special issue or circumstance going on. They are probably going to be in those chair classes or those beginner level classes. Then you can offer workshops. You could offer a workshop for I just had a class for years, you guys, that I taught before yoga therapy was really popular, that was called therapeutic yoga. And it had a chair and an option of standing. So for every pose that I taught, I gave an option for the version of it that was in the chair or the version of it that wasn't in the chair. Hard as heck to teach like that. So you might just do a chair class, but give different versions or different options of every posture. So for instance, if you are going to do, say, this posture where your hands are in front and you open them, and you close them. So it's an inhale, open, exhale, close. That's for the upper thoracic. It reduces spinal degeneration, increases circulation around the heart. I know all that because I've studied it. So if you're going to do something like this, arms up and arms down, again, for thoracic back, circulation, keeping the shoulders back. You get a lot of problems as people age with rounding in the spine. I'm going to offer this instead of this if people in front of me have high blood pressure, if they tell me that they currently have high blood pressure or it's not controlled. I'm definitely going to offer the option that does not take the hands above the heart. If you need further information on this, in the book I wrote, The Mud and the Lotus, I give all the contraindications for each posture, and you will be able to tell. There's only like 25 postures in the book, but it's kind of broken down, like it's general for arms above the head. So you're not going to go into a cardiac clinic and be teaching Warrior One with the arms above the head. You just want to assume you probably shouldn't do that, right? So it's going to probably be down here. And quite frankly, in the world of yoga therapy, especially medical yoga therapy, we're really not getting their heart rate up at all. This is not about exercise. It's about a therapeutic prospect or process, I should say. So maybe you would offer workshops on this subject to students. So you might do a chair yoga workshop for teachers and students that is around cardiac care or around cancer, and just come up with everything that you've learned and share it in a workshop so people can use that in their classes. That's basically what I started doing. I had the therapeutic yoga class that I taught. I went and I learned about all of these different things: Prime of Life yoga, yoga for healthy aging, restorative yoga. I took all these workshops and then I started teaching those classes. And as I did that, I gained more knowledge. I learned more doing private lessons for people. So I also had retreats for a long time. Now, I put on a retreat every year that was geared towards yoga teachers and students, but primarily yoga teachers, and it always had a therapeutic aspect. So as I became more interested in yoga therapy, my retreats had a more therapeutic aspect. They were retreats in the sense that they were fun, but they had a learning module. So I would offer different things that were maybe 2 hours of what is yoga therapy or what's emerging in the field of yoga therapy. So what happened for me is when the time came when the company that I work for now came to our area and was looking for someone to work in cardiac rehab, the powers that be, people that knew me, knew that I worked in this field, knew that I worked with special populations, and I was recommended for that job. So the more that you get out there and you do what you're passionate about, the more chance you're going to be recommended for that job when it comes along. Now, let's say something happened tomorrow and I didn't have my job in the yoga therapy world anymore as in cardiac rehab. I would probably approach hospitals and doctors with what I do and see if I could offer classes there for their patients and to help with their retention as well as just helping with their patients. I'm in a pretty special situation where there's not a lot of jobs for yoga therapists around here. The VA has them. I know that the let's see, my cardiology clinic has them. There's another cardiology clinic that has yoga, and then there is a cancer clinic that has yoga for cancer. I do know that 2 of those clinics don't really have yoga therapy, so to speak. They're just general population yoga classes. And quite frankly, what I do is not general population yoga classes. It's very gentle. I went into this thinking that my students could do more. And so I did the prescription exactly as it is taught for the company I work for. And it is a prescription, but I've actually had to modify and take it way, way back because we have a very rural population, a very sick population. A lot of the people that we have diabetes and neuropathy, and they've had multiple back surgeries. It's really tough, and so sometimes just standing up is challenging, or sitting down for long periods of time is challenging. I had to order special chairs this week just so my people could sit down for an hour and do the class. So you have to just really be mindful. You have to learn to watch people and to really think about what they need. The last thing I would say is you have to be aware of who you're working with. When you're working in the medical community or with the medical community, they are not, if you go in there being all hippy dippy and, as we yoga teachers can be, and, I was raised that way. I'm definitely a 70s girl. But when I go into the office, I try really hard not to be like that. It's not that I changed my personality, but I saw yesterday, I was reading, we have like a hall of fame, if you will, of our clients that have gone through our program. And I was reading one, and he said, I always thought yoga was for paisley wearing, butterfly type hippies. And I found our yoga therapists to be very poised and professional and knowledgeable. I go to work in comfortable pants, a cute little top, comfortable shoes. I do not wear yoga clothes to work. I do not wear scrubs, even though I'm allowed to. I go in there just looking professionally dressed in what I would call dress casual clothes that I can move in, and that is how I teach. I do not go in there looking like I just walked out of an episode of Grace and Frankie, like Frankie, my favorite show. But I do not go out there looking like that because I don't want them to see me as just hippy dippy. I want them to take what we're doing seriously. Also, doctors don't necessarily, if you're going in there and you start talking about the 8 limbs, the Panchamaya model, the koshas, which are the same, but people have different views on that now. Or you start talking about things that are very unique to yoga that we might all understand in the yoga world, you're going to lose them, and you're going to push them away, and it's going to be over before it begins. You need to be able to talk about the benefits of yoga on a very basic and, if not scientific level. Like, for instance, studies show that practicing gentle yoga for stress management helps to lower cortisol levels, thereby also helping to regulate the heart rate, the blood pressure, and also helps with depression and anxiety. Something like that. You don't want to go in there and start talking about samskaras and ama and all of these things that we talk about. You've got to turn it around and talk about it in language that is easy for them to understand. So I hope this has been helpful. If you want to learn more from me in September, the 3rd week in September, I think it's the 21st, in Conway, Arkansas, I have a workshop called Yoga for Healthcare, and it is about working collaboratively and with the medical community. It is right now it's a 20-hour training. I'm thinking about taking it down a little bit to about a 16-hour training. So it'll be 3 or somewhere between 16 and 20. It'll be a Saturday and Sunday, and you'll get some videos beforehand that I'll ask you to watch, and you will get a certificate that says that you've completed the program as well. You won't be certified, but you will have, you will be trained to work in the medical community. And it's a very basic training just to help you understand, like, what do you do if someone has a port? What do you do about osteopenia and osteoporosis? How do you handle wheelchairs? Things like that. So yeah, I would love to have you. Please give a thumbs up if you like this video and subscribe. Thank you so much. And please, if you're interested in me more, you can buy my book on Amazon or at major retailers, The Mud and the Lotus, a guide and workbook for students of yoga. And I have 2 more books coming out this year. One is on offering workshops and retreats, and the other one is on opening a successful yoga school. Thank you so much. Have a great day.